2nd at 3 p.m. on Wednesday, and we will begin with the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I would also ask for a moment of silence so that we can remember with much gratitude and prayer those who serve our country currently overseas and those who are no longer with us. Thank you. All right, so we're going to begin with a presentation on the new dental discount program for employees of...
That's right.
No, for everybody.
For everybody.
All
For
the citizens of
everybody.
Barnstable
Right.
County.
Everybody. I do
All
have
the
copies
citizens.
of the presentation for you, Beth. I don't know if you
You
need
don't
one.
want to know?
I'm sure.
Um,
I do have
And we are very excited to offer this new program. And let me tell you a little bit about it. It's a dental discount program, and it's a pilot program offered through NACO, which is the National Association of Counties. And what it does is it will give participating members savings of 5% to 50% on most of their dental procedures. Right now we have 38 participating dentists across the Cape, and if you go online, and I'll give you the website in just a minute as part of the presentation, you'll find out who those dentists are and where their offices are. And the good thing about the program is a member may visit any participating dentist, and you can change to a different participating dentist anytime you want. And the program is administered by Carrington, and NACO has done programs with Carrington before that we are participating in. You're perhaps familiar with the prescription drug discount program. That's been a
$3.25 of $1 million
successful program.
savings for citizens in Barnstable County.
That's right. That's been a very successful program for us. So what this dental discount program does, it provides discounts available at the time you receive the service in the dentist's office. As Bill had indicated, everyone is eligible to participate. Doesn't matter whether you have health insurance or dental insurance, none of that matters. You're eligible to participate. There's no limit on the program usage. Many people who have dental insurance, they have limits on how much services they can incur every year, but there's no limit on this program. But I want to stress that it's not an insurance program. You're not buying an insurance policy. It's really a membership-driven dental discount program. So there is a rate or fee involved for the service. You have to become a member. The monthly fee for an individual is $6.95, and it's $8.95 monthly for a family. And you can pay it on an annual basis if you choose. And for an individual, that'd be $59, and for a family, it'd be $69. And how do you access the program? You can call 877-354-NACO, which is 6226, or you can visit NACOdentalprogram.com. There's a little box that you select to join, and when you do join, there's some information that you have to fill out on the online program, or if you call, a representative will take your name and your information and all that, and then you'll make your payment. And they'll provide you with a member ID number. If you do it online, they'll take them 7 to 10 days to mail you the information, but eventually you'll get a member ID card and a member ID number. So what you would do is you would select the participating dentist, and again on the website you can select find a dentist and go in there, and there will be a list of participating dentists and where they're located. So you call one of them and you schedule an appointment. And then you want to mention that you're a member of the dental discount program through NACO in Barnstable County. And when you go for your service, you present your membership card at your visit. The discount will be provided to you at that point in time, but you are expected to pay in full for the service that you receive when you receive it. So, and I would say that anybody that has any other questions about the program at any time going forward can either contact Beth Albert, who's here today. She is the Director of Human Services at the county. and her number is there, or they can contact me directly. I'm Mark Zielinski, I'm the county administrator. They can call me directly and we can try to answer any questions that people might have. So I would say I did an interview on XTK and an interview on QRC, so they'll be playing for information. Beth has had her staff send out the display packages, which she has a sample of there for you, that you can see and show the camera.
Good.
Those are at all of our participating dental offices. We're going to get some more of those. We're going to put them up in, I think, the town halls here at the county would be a good place for them. But you don't need any of that information. You don't have to physically get that information to sign up for the program. All you have to do is call 877-354-NACO or visit nacodentalprogram.com online, and you can get all the information about the program that you need.
And NACO is NACO Dental Program.
.com, all one,
.com, all one word.
All one word, yep.
Okay.
No, you got it.
I was just going to ask, so you paid your $69 as a family, and now you go for a teeth cleaning, that sort of thing. So it would be anywhere from, what is the percentage of discount do we have?
They're saying 5 to 50% on your average services.
And is that up to the discretion of the participating dentist, or is there a roll-up, is there like a mandatory what they would be discounting for particular services?
I think it's different for different providers because they have different fee structures. They did do, and I believe this is available online, they had a nationwide chart that described some of the sample savings. And for example, it has the service code is on there, but for example, periodic oral evaluation, program cost is $24. They're saying that the regular cost nationwide, the average cost is $49, in which case that's a 51% savings. Probably in Massachusetts, both of the program cost and the regular cost are going to be a little bit higher. But, so it differs from region to region across the country. They're saying that it's a 5 to 50% savings.
You know, one of the exciting things about this as well is that the county has supported in the past the Ellen Jones Dental Clinic down in Harwich, and we've always been proactive with regard to trying to do what we can to provide some avenues and venues for dental health support. So I'm very excited about this. This is a beta program that that NACO is running, and we have been selected. I think there were across the country. Was it like 30?
I was going to say 25. It's not many.
Not many. 25 counties were selected to roll the program out. And I was very happy that that NACO had selected us because that would get that benefit in the hands of our citizens as soon as possible. And I have to say that all the health programs that are being offered do not include a dental benefit. So, Barnstable County, when they ask, what justifies county government, I think that the pharmacy program, the dental program shows that we are continuing to provide direct benefits that matter to people to keep the health and wellness here at the county, which of course is consistent with our mission to enhance the quality of life for all of our citizens.
That's right.
Very well put.
I have two questions.
Yeah.
If let's say you have a dentist that you've been going to for a number of years and the dentist is not in the program, can you ask him if he'd be willing to join and are they selected by NACO? How is a dentist determined to be a
I
participant?
believe it's a two-way street, and I certainly would recommend that anyone who goes to a dentist that they find is not on the NACO list, that they encourage their dentist to call Carrington. I don't have the number, but I can certainly provide that for them. Call Carrington. Carrington is the administrator overall of the program, and sign up to participate. I think that would be good. We want to encourage as many dentists across the Cape to participate as we can, because that will broaden the services available to all the people.
I bring that up because I know under the managed health programs, managed care programs that we used to have, that if your doctor did not participate, let's say, in a POS, point of service plan, you could ask your doctor, because you wanted to stay with that doctor, would you be willing to be part of Blue Cross or something like that?
Yeah.
And sometimes they would.
Yeah,
So
exactly.
it enabled you to continue
Someone may
on.
not know about it, so that would be good too.
Exactly.
Yeah.
The other question I had was, let's say a resident or anybody here on the Cape already had dental insurance of some kind.
Right.
Sometimes dental insurance doesn't really pay a whole lot, depends on the type of plan.
Right.
Would it be possible to have both?
Yeah.
To have a dental plan and then to also enroll in the discount plan?
Well, absolutely. You'd have to kind of weigh the costs and benefits, but you're certainly eligible to participate. And as I said, a lot of times dental insurance programs have an annual cap. Not great annual cap. Most of them around $1,000. We're sort of familiar with those programs here at the county. So once you reach your $1,000 limit, if it's not preventive or the exam, it's not covered. So this could cover if you needed service, a crown, or if you needed a root canal, or if you needed any other type of service when you reached your $1,000 limit, this could help you. And you just have to kind of weigh the price versus what the savings is.
That's good. That's good to know.
I'd like to ask and maybe make a suggestion if it hasn't happened. Have we done a press release on this?
We've done a press release, and Beth put the press release out last Monday, so that we got it out ahead
To
of
all the
time.
newspapers, all the
Yep.
radio stations?
Yep. And actually, XTK and QRC called me, one yesterday and one today, and I did an interview on the air with them. So there'll be that spot we'll be playing this as well. I think they sent us, as I said, those limited, there was I think 20 or 25 display cases. We sent those out to the participating dental offices. I think we need to do some more, maybe getting them into town halls and where some other people are.
So we
Getting
do,
the schools,
we've
those
got
types
outreach
of
to do.
things.
So,
Yeah.
so
That's
I mean,
kind of
have
where
we
I
sent
come
that
in.
press release maybe to like the other human service
Yeah.
agencies and?
We're doing a presentation tomorrow at the Health and Human Service Advisory Council.
Mhm.
So they're all going to get these flyers, because we're bringing them in bulk. We are in the process of getting some more of these enrollment cards, but it's easy, and it's also on the Human Service website. It was posted yesterday with the link. So yeah, the outreach, we're rolling it out
Right.
and trying to make those connections.
I think it would be good for us to have a copy of that because, we have other group,
Sure.
that's
Oh,
involved with a
absolutely.
lot of different groups and so is Bill, that you could just shoot that off to these different emails, just saying NFYI and
Sure,
it also promotes another good initiative.
exactly.
Telling
I
you what
can
we're doing. so.
make some extra copies. We'll hand out of the presentation. We can get
Here.
some more of the little flyer forms and the cards.
Is that available on the facsimile of the form available on the webpage?
I haven't done that yet, but I will do
Yeah.
that.
Because if we do that, then we'd be able to, to attach it to the email.
I did the
Right,
announcement
exactly.
with the press
And that way
release.
people can have it.
Yeah, and I want to remind people for the viewing audience again that you don't need the card. All you need is the number 877-354-NACO or the website nacodentalprogram.com, and they can find out all the information that they need.
And right, and on that website too, you can get a list of the participating dentists.
That's right.
So, it'll be-
Some
Dentist
might
on there.
already be.
is my dentist on there? Actually, my dentist is on there.
Very good.
I want to point out to Bill that the Barnstable County logo is at the top of this page.
I
Yes.
saw that.
That's right.
I thought you would be happy to know.
We are
Yes,
on
I'm
there.
very happy, and you know how much I believe that
With the fish.
Yes.
with the fish.
And
That's
what
right.
we'll do is, I think over the next few
Makes you
meetings,
proud, doesn't it?
we'll do it at the assembly meetings coming up. We'll kind of keep mentioning this for a while so it catches on a little bit. I do want to say, I think Beth and I will be working also on the prescription drug card. I don't want to confuse it too much, but we're going to do kind of a new rollout, I think, of that
I
as
think
well.
that's-
It's time to maybe
again,
remind
time
people
to
that that's out
renew.
there.
Right.
I would say, I think I actually didn't bring it with me, I had it with me. Oh, yes, I did. As Bill mentioned, every month we get a status report on what's going on with the prescription, and I guess I didn't bring it with me, with the prescription drug discount program. And the usage continues to go up. I believe the last data that I have here, unfortunately I can't put my hand, there it is. We have, just to let you know, a total number of utilizers of the card in August 2010, 848 people. So 848 people use the prescription drug card that we have. That contrasts with, let's go even into a year into the program, January 2008, we had 477 people using it. So almost twice as many people are using it now, not quite, but. And I would say that those 848 utilizers filled 2,279 prescriptions. And their average savings on a prescription price was $14.28, or 28% off the retail price. So that's pretty good. That's pretty good. I think Bill had given the total savings number, and that is, just looking for that month, $32,500 for.
And that's for only 800 people. So again, I know that now that I'm off my trail, in talking to people about even county government and what does it do, if you bring something like this up, it's totally unknown. Like what? That sounds like a healthcare thing, and it is, but it is because of our affiliation with NACO and Bill going down there and being present. So I think that there's many more people, if they were aware of it, would take advantage of this. And it certainly helps, because even with health insurance, it doesn't always give you that, it's cost that much extra to get prescription coverage, and that's what can kill you all around.
But the other piece, I think, too, is that the county worked, or not, well, the county plus like the human service agencies and so forth, and the medical community worked really hard to get dental care available to people on the care. And that's been impacted by cutbacks in funding and the economy. So here's an opportunity for the county to come in these desperate economic times and be able to offer dental health programs, which we all know are so important, starting with a pregnant woman all the way through the childhood and adulthood and so forth, and how oral health is such a major component of anyone's overall health.
Yeah.
So I think this is a great opportunity, like you said, to say this is, what can the county do? These are some of, this is a good example
We
of what
fill the gap of what the
Exactly.
state can't, or what the towns can't do, and what the state is either unwilling or can't do.
Well,
However you want to phrase it.
when these things come up, and I read things in blogs and things like that,
Right.
especially when there's somebody up in Plymouth County who says that they want to dissolve county government, and says, well, on Cape Cod, county government is still popular. You just mentioned the dredge. It isn't just the dredge.
It's not just the dredge.
It's not just the dredge.
No,
and by
there's
the
many
way,
other things.
we are the only ones who once asked the people who live here if they wanted to keep us, and they said yes.
Yes.
75% of the people who voted said yes, they wanted regional government, and they wanted us here. So at least we have the benefit of that, actually having asked permission to continue, and we were granted that permission.
And so we have to keep reminding them why we are relevant in
That's
their
right.
lives. So I think this is a good opportunity.
One thing I just want to add and remind people, hopefully a lot of people will take advantage of this program, they'll utilize the program, they'll save a lot of money. I do want to mention it's a pilot program, so usually with a pilot program you want feedback on the good pieces, but also on maybe the pieces that aren't working so good. So I would encourage anyone who takes advantage of this program, who signs up and who utilizes the program, to give either Beth or myself a call after they've been through the process and just let us know if there are issues, if there are things they like, if there are things they don't like, so that we in turn can feed that loop back to both Carrington and NACO.
Yeah, the whole idea of a beta program is to get that kind of feedback, because in tweaking the program to make it better, when they roll these out, there's always a presumption that they've covered all the bases.
Right.
And it's not until it's actually in the field and people start using it that they know which things have to be improved or tweaked in order to make it as close to perfect as possible. We're trying as much as possible to find programs that are not going to cost our consumers or our taxpayers more. And I think one of the more important issues, which we haven't really mentioned, is that after we rolled it out and used our administrative staff time to, let's say, to set the program up, The management and administration of the program is not something that is part of the burden for the, for the county administration costs. So I think that's an important thing for, for the taxpayers to know.
Yeah, there's no cost to the county in any way, shape, or form.
Other than in-kind labor that
Just,
you
yeah, the
all
time
have
that
provided,
we- yeah.
and that is a lot of work. And that is a lot of work over that
And
happens.
don't make any mistake, that is what the assessment that we get from the towns is supporting, is
Right.
that kind of setup, to get a
Right.
benefit for the people who live in
Right.
those towns.
Bill, could you explain what a beta program is?
Or not.
In those days when I was a product manager, we would come up with a product, and we would then, after we went through engineering evaluation, we would then try to find a customer who would be willing to take that product and put it in service. And we would call that a beta site. So in other words, the alpha is producing the product, the beta is basically testing the product. So the beta, the beta process is that we would get feedback from the user before it went into, let's say, into wide or global distribution, and that feedback would give us the information we needed for any changes that had to be done on the product, any significant issues with regard to does the product live up to expectations and meet the specifications that we've made for it, and then when we had it, usually beta testing usually took about 6 months or a year, and after that point we would be able to make the investment in the manufacturing of of it globally, and then would send it out and would then meet the so-called quality assurance, quality control pieces, so that we would have a product that had been user tested, found to be to meet expectations, and had the reliability that we could confidently invest our resources in it to produce it. So that's what
That's what a beta program is.
Okay, so it was suggested that, there's Cape Care, and then there's Cape Cares, which is a totally different thing. So this is county care.
Well, we are the county that cares.
We are the county that cares. That's a good slogan. So,
So there you have
It
it.
came out of the Human Service Department, by the way.
Yeah,
yeah, I mean, they make us look good.
Tomorrow we'll roll it out to the Health and Human Service, the Human Service Advisory Committee. I'll do a presentation to the town administrators. They can share that with their employees and whatnot. So
Right.
we'll try to
Hopefully
get some.
get it out to their citizens as well.
Oh, and by the way, at the MMA meeting today, Cape Cod was called out, and Franklin Regional Government was called out by a couple of the members saying, we are the poster children for identifying how people work together in order to provide programs. Now,
Like we didn't know.
well,
yes, I
No, but
heard
others
that
do.
repeatedly.
No, we are. We're very.
Collaborators is what we
So we
are.
have to.
and We know how to
communication,
do it.
collaboration,
We do it very
coordination.
well.
All right.
It's interesting.
So we're getting some recognition for that, because the others were complaining about how nobody was working together and fighting each other, and that's when they brought up the fact that that doesn't happen here.
Well, I think when you're on Cape Cod, we're all Cape Codders, and we all understand at a certain level.
Well,
Even though we have our parochial loves, that in the end we gotta.
Whether we were born here or came here,
Right.
Cape Cod is
We
not a
love it
place,
here.
it's a way of life, and that's what makes us all Cape Codders.
That's right.
But enough of the campaign rhetoric.
Yes, I know you're done. I mean, I don't know why you're.
Well, you can't let up.
Yeah.
We have something else to talk about today.
Yes, the next item on our agenda actually is affordable housing, but we're going to have Paul.
Hey, well, yeah, let me see
When
if
is he
he's.
coming? Yeah, because it's just about 3:30.
Yeah.
So,
Because we like you.
yeah.
Well, in the meantime, could we, perhaps we should take a look at if I may, could we take a look at the needs action? Is there anything we should be talking about?
Oh, we can do
Okay.
needs action
All right.
next, yes.
Are you gonna be here later?
Um,
I just left a message in your phone.
Oh, you did? I did.
That's okay. Are you leaving like at 4 or something? I mean, when are you out of the building?
Whatever I've done, that's what I'm doing.
Well, let me.
I can,
Yeah, you know what? If I'm still here, if I haven't been down to you, just swing by as
Okay.
you're going out and say
Okay.
hello or goodbye.
so are we, I'll come back.
That,
Is there anything
Is
else
that
you'd like to
No,
report on?
that's
And
just
no, I'm
something
waiting,
I
I've
saw.
got my names on the agenda for affordable housing.
Oh.
with Paul.
Oh, well, he might be here in a minute.
Oh, you want to check out number 6?
Yeah.
So,
Okay. We're going to vote on our
Here it is.
on our actions, but there's a question on item number 6, which is execute an agreement with UMass Donahue Institute for analysis of towns, plural, financial capacity to build wastewater infrastructure.
These are the, well, in looking at this, this is for data collection and for data analysis, and I believe that that's one of the issues that the wastewater collaborative was very interested in doing.
And that was one of
to
the things
create a financial
we
model.
gave them. We gave them that as a task, that they had to look at that, so they're,
This contract apparently covers that task.
yeah, it's, they're helping them gather the information and do the
So
survey.
I'm prepared to move the...
So that they are working with the collaborative on this?
Yes,
And
absolutely.
that's what that contract seems to say.
Okay.
Okay, then I'm prepared to move the...
I will second.
Okay, all those in favor say aye.
Aye.
Opposed? None opposed, 3 in favor, motion carries. So you can start if you
I
want.
just, while we have a moment here, I just wanted, and I know it's not on the agenda, but I do, would like to put on the agenda for next week. I did have a meeting with some people from the water planning boards, various, there were different things, planning board, financial board. Many of the ones who have written us the letter from the town of Orleans. I met with Mr. Ed Daly today, and Mr. Armand, and former selectman, whose name is going to go right over my head. And I have agreed to, make sure that they have a meeting with Andy and Brian Howes to go over some of their concerns and questions about our proposed symposium, their thoughts on that, and what their kind of concerns are about the whole
Present.
Okay.
Is Gussie-
proposal.
Is Gussie McKissick going to be part of that?
She may, I'm going to talk to Andy about that, but I think right now it would just be a good thing for people to have a good conversation. But they also would like to come and meet with us, so I said that I would discuss that with you and try to get them on the agenda, if not next week, then the week afterwards. I think that would give everybody time to have a conversation. But I did meet with them. I think that what we all came away with is that we recognize that this is a very beautiful place. They have questions on, some of the numbers that were initially proposed as far as nitrogen loading, particularly in Pleasant Bay, that's what our whole conversation surrounded on, are different. They were lower nitrogen numbers in 2009, the end of 2008 taken as opposed to the end of 2006. Well, that is because the barrier reef got broken open on one of the, so there is more about flushing. And actually, if you read the report of Brian Howes, he did state that that was going to be a possibility, that some of that barrier reef was going to, be broken into, and that would make a difference in the composition of nitrogen levels at a certain area, particularly at the mouth, not at the river coming in. So I think that
Are any of the selectmen going to be part of this? Because they're the ones that sent the letter.
yes, they did. And as I say, I think that, we can discuss that a little bit with them. But I do think that it's just a good thing for Andy and Brian to go down and, face to face just have these concerns shared and opened up and addressed. So that, because I believe that everybody in that room and everybody in this room and what we're doing all want to see a positive outcome. It's just that, and I said, I don't have so much problem with the science, because the science is going to vary a bit from here to here, but I wasn't going to get into big arguments
No,
with that.
the science won't change.
Right, the science won't change.
Remember, you're looking at something that occurs at an exact instance.
Right, and that's what I said, you're looking at a snapshot in a frame of time. However, these are guides, and we all, I don't want to really hash this out since it's not really on our agenda here, but what I did state was, I think that some of they're all very, engineers, chemical engineers, and various types of engineers of one sort of another. input might even be better served as the implementation phase goes on. Like, how can we best implement, what are the best structures? And, since they're engineering people, that's, we do want, we want everybody to feel comfortable going forward, but those are the ones that we're really going to be,
Well,
hashing out
again,
those details.
And I would remind you that you're the one that was promoting the idea of having elected representatives on the wastewater collaborative.
Yes.
And since the letter was sent from the select board
Yes.
of the Orleans, town of Orleans,
Right.
I would strongly recommend that they be invited to
Yes,
participate.
I agree, and I think that would be a very good thing, because, it's just really just answering questions. I think that sometimes people just need to feel that they've been heard and listened to a certain degree.
By the way, the discipline of chemical engineering has more to do with nuclear power than it does with
Well, actually,
water
we went
control.
into that a little bit, it wasn't big.
But you talk about implementation, and that's really where this discussion comes.
Right.
Because if you have an estuary that has an issue with nitrogen loading, there are many ways to address it. And one could be like widening the mouth of the estuary or putting in a culvert. But again, you have to look at what the tides are. So, I mean, there are
I
so
know there's so
many
many
things
things.
related to that.
Right.
That when you look at the pounds, what is it, millimeters per pound
Mhm.
of nitrogen,
Milliliters.
milliliters per pound,
No,
milliliters,
per square.
milliliters per pound of nitrogen.
Nitrogen, right.
When you look at that, I mean, it's all so, it can change
Exactly.
over time. It
Should
could
be
change
kilograms of nitrogen. Milliliters.
milligrams.
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 But
So
just
many
because-
milligrams per liter of nitrogen. That's
But just because there's been a reduction because of some natural occurrence, like a barrier reef,
Exactly.
doesn't mean that there isn't a problem. And I think that's where we have to come to.
It just changes what you do, perhaps,
Exactly.
and you have to
Right.
look at, well, if this was maybe the plan you had for implementation, you may want to change that now because you can modify it and do something different.
Right, and it's
Or
going to be
maybe
the
not address
implementation
it at
and
all.
where it's going to be, but.
And
I just-
density, like in Falmouth last night, they just removed the whole western part of the designated area for addressing the nitrogen loading because it's a very, it's not a very densely populated area. It's so less dense that they said, we don't even have to deal with that now because there are not enough people that live there that can really create that kind of nitrogen. So we're going to concentrate on the more dense areas because they're the ones that
That's the
we have to
hotspots.
look at first. So that reduced the cost from $600 million to $312 million.
See,
So
dilution
it's
is the
all on
solution.
how you look at it, huh? But if you don't get into the discussion of the implementation,
Right.
forget the science, talk about implementation,
Well,
then all of these things will come.
and that's where I think we are.
That's
But
what I
anyway,
think.
so I just wanted to relate to you that I did have that conversation today.
Since I've now completed.
I will bring you up.
102, and I'm starting
I know.
103.
I told them that you were good on this, that you've been going all those socials.
That's
Okay.
gonna come back,
Okay.
but both Paul and I are a little pressed for time.
Okay,
Yes,
well,
so
let's get going.
that's good.
So,
This is, Bill asked
Bill,
for
Bill.
this
Yes, I
discussion.
did.
And I
we'll-
gave you
we'll
a
make
copy
it
of
brief.
today's flow.
This is like a follow-up to, you were here just
Whatever it is.
5 weeks ago, was it not?
Anyway,
Something like that.
And I think,
5 weeks is a long time to remember.
Yeah.
Time to remember.
I remember seeing you recently.
Well, the reason we're here is to talk about the ballot question.
Sure.
question two.
Primarily,
proposed by
question two.
initiative petition and the comprehensive permits for low or moderate income housing.
Right.
Many of us who are involved directly in the production of housing, and as am I, as a chairman of the Howard Housing Authority, are very concerned that the leverage that we have to get support for housing, housing activities, transfer of land from the town to the housing authority to support it, would be materially interfered with if this were to pass. We are told that although the proposed would not prevent a project going forward that already had a comprehensive permit or building permit for at least one unit, we are told that there are 12,000 projects across the Commonwealth that do not have the these comprehensive permits or building permits in place. So therefore, all of those projects and the contribution that they would make to the economic development and the creation of jobs, which are so crucial with 300,000 people out of work in the Commonwealth, to me is deeply disturbing. So I've asked for this, for this time on the agenda to talk about the commissioners perhaps being willing to take a position to support it, and with taking that position, perhaps that would allow you as as staff to say that if the commissioners agree to support voting no on this, that would allow you to speak to the housing, the members of the housing consortium and the other housing advocates, and allow you to talk to the human service committee, the Human Service Advisory Committee, to say that the commissioners feel strongly enough about this that that they would like to get more support so that we vote no on it. Now, does this mean, in my opinion, that that reform is not needed? Well, that's not true. But over the years, we have through the MMA and through other venues promoted the idea of trying to incorporate reforms that would allow for the production of housing and not allow any loopholes that that provided an opportunity for what is perceived as being excess profit on the part of developers. So, having said that, would a no vote stop that concern about going forward? Not at all, because I continue to advocate up at MMA and through the housing through housing resources for that, and I'm sure that all of us here are very concerned about supplying the need on Cape Cod for both low-income rental housing, which is what the housing authorities are responsible for, but also supporting the need for affordable housing, which is which has combinations of both rental and for direct purchase, so that we can supply that that gap in housing. Right now, the Howard Housing Authority has 300 families on the waiting list, and that doesn't even cover what some of the other housing authorities have to recognize that. Nor does it cover what I would call the need for SROs, single room occupancy housing, that's needed, for those types of apartments. So the need continues. The opportunity that's provided because of the leverage of the existence of of this statute, is there. We don't want to lose this now, and we don't want to stop this opportunity for, in my opinion, stop this opportunity for the 12,000 projects that have investment but haven't gotten to the comprehensive permit point. So with that, that's basically the request that I'm asking of the commissioners. And at that point, do you have any questions?
I'm so glad Paul and Beth are here. Since, did that sum it up properly?
That summed it up reasonably properly.
Well, you see, if they were approaching us with this, that would be advocating. They're not supposed to do that.
Right, okay, so is
Well,
that...
we can,
They can answer
Well,
questions
obviously,
and they can
just take-
inform.
so, yeah, I would like to...
okay, we can inform,
Yeah.
and even members of housing committees or housing authorities can take a position
Right.
on the question. You just can't use any public, like I couldn't send out emails in support or against it or that kind of thing, but we certainly are free to take a position on it.
So is this going to be a personal position, or you can just give your...
What I'm suggesting is that we take...
No, yeah,
Okay,
and
that
that's
would
what
be
I think
helpful.
would be a good thing, even just for the population, because you can say all of these things, but what
That's
does
what
this
Wait a
I'm
mean?
minute,
Sure.
he's asking
I'm asking
us as
us
commissioners to
Right.
take a
Make it a
position
matter of
and make,
policy, so
do
that
a
they,
public
when they go to
statement.
talk to these people, they say that the commissioners have taken a policy
Adopted this position.
statement, a policy position with regard to supporting a no vote on this.
Yeah, and I heard that, but I was just wondering, just for backup, what the statistics are and what he can speak to as far as, it's great to say all of those things, but what, it's good to be able to say, based on the fact that it has provided,
Right.
so,
Yeah,
If you would.
basically the data shows that it's 39% of all the affordable housing of the 5,300 plus units on the Cape have been permitted via Chapter 40B. Historically, over the last decade, it's 81% of all the new, we've created almost 1,600 new affordable units, and if you take out the 300 or so group home units that got added because of the regulatory change, basically 81% of the new units this decade have needed to be permitted by Chapter 40B, and it covers all size projects from the larger, 48, 58 unit Main Street project in Falmouth to Habitat doing 2 units in Mashpee that needed Chapter 40B. So given the fact that residential land, 70% of our residential land is an acre or more, zone for an acre or larger, it's just not economically possible in most cases to create affordable housing without it. So, and just, I don't know how many comprehensive permit projects have been permitted but are just on hold right now, but I do know where I just was coming from. I've got 6 rental housing applications before us for home funding. For the first time ever, we've got more requests for money than we've got money available to distribute. But 4 of those 6 have been permitted by Chapter 40B. And if the initiative passes, I think the chances are slim for those projects being able to get their building permits before January 1st. So, Bill, you noted, I mean, it's not only the housing that's being provided, it's the sort of economic incentive by putting folks to work building these units, which is just critical in the economy generally, in particular on the Cape's economy. So,
I'd like to ask a question. On some of the affordable housing, usually this is something that's coupled with a developer creating a development of some kind, so there's a certain portion that has to be given to affordable
Right.
housing. So when you have something like Habitat come in and apply for that assistance, is that attached to a development that's going on somewhere in the area? How do these, does 40B help individual just housing, affordable housing units to occur without being attached to some other development, commercial or private development?
well, it can be used for very small projects like the 1 or 2 unit standalone single-family homes that Habitat, but it can be used for larger one. On the Cape, the average size of a 40B project is 16 units. The average size is 25, the median size is 16. So we've been relatively modest sized project sizes that have been done in the 40B. 57% of all the units in a 40B development are affordable on the Cape.
Okay, so that's the
So
ratio.
the 25% is the requirement, but since the Habitats or other nonprofits, the housing authorities have used it, and they typically provide 100% affordability. So it's 57% are affordable in these developments. So we're not just doing the minimum of 25%, it's been significantly higher over time.
Now, there is also a cap that each town is given, so I know that most of our towns haven't come near that cap.
None of our towns
Have
Have hit the maximum, the
have hit
10%.
The 10%.
Yeah,
Orleans is the closest
It's
at
closest.
8.8, I believe, is where they are.
Could you just explain how that
and what
works,
happens,
Paul?
what happens after they've met that 10%? Does their eligibility or does the cost decrease?
They're exempt from 40B.
They're exempt.
They're, right, they have, if the town achieves 10%, it provides the zoning board of appeals, if, somebody can still propose a 40B development, but if the zoning board thinks it's not a good project, they could say no, deny that project, and there wouldn't be any appeal by the applicant. If they think it's a good project, then go ahead and approve it. So it doesn't stop towns from approving projects that they
Go
think, but it
beyond.
basically gives the zoning control back totally to the town, whereas right now, there's this way to exempt it because you haven't met the goal of 10%.
So none in the county or
No.
any in the state?
There are,
Ready, I
I believe, the last I saw, Mark, I believe it was 51 of the,
Really?
they've got 300.
Right.
It's about 15% of the communities in the Commonwealth have met the
Their
10%.
10%.
But
So it's
that
not
is-
an unachievable.
Paul, do you have
Some of ours are very, very close.
do you have a sense of how many of the towns on the Cape have housing production plans?
I believe half a dozen
Half a dozen?
do have a formally a state-approved plan. There are a couple of communities like Wellfleet and Provincetown that have a housing plan. They chose not to go through the state process, but they've got a plan with goals and actions that they're following. So more than half of the communities on the Cape have done that.
So if we have a sense of the board that we want to pursue a public statement on this, is that a fair statement? Are we interested in making a public statement on question 2?
Well, how do you feel about
Well, I think that first, my thought was in this whole idea of 40B, you tend to always look at the problems associated with it first, and then you turn around and look at the positives and what it would be if we didn't have it.
that? Exactly.
And I don't think we would be where we are today without 40B, so I think we should do it. I think we should make a public statement supporting no on question 2.
Well, then I would like to propose that we ask Mark to frame, or actually ask Paul to frame a statement for us to sign that we.
Yeah.
Let me just throw this out. I think what you are endorsing is a position that because of the potential impacts of the loss of the 40B tool through ballot question 2, you're urging voters to vote no, and that is your formal
Right.
So that
position.
we
Right.
retain-
And that is not to say that we don't recognize that there are some flaws in it.
Right.
And I do think that there are some aspects that can be abused if
So-
not carefully scrutinized by boards of selectmen.
So
But on the
we should
whole,
take a
for the
vote.
Cape, it has worked very well.
So it's like recognizing that the 40B,
Actually, we're talking about this particular article here, the comprehensive permits for low and moderate income housing, and they don't reference 40B.
they don't write reference, so it's really the question,
Question 2, the law
Okay.
I mean, it comes down to 40B, but the initiative
why don't we do
petition.
this? Well, because this is time sensitive only to the sense that it's November.
Well, it's time sensitive to the sense that there's a human advisory committee meeting tomorrow, and I wanted, Beth to be armed with the idea that we have taken a position to support it. So I think we could take a vote on it.
Although one of my concerns that I was originally going to keep to myself is that putting the cart before the horse sometimes, because they are your advisory
Yes.
council.
What's the
So-
connection between this and tomorrow's meeting?
I just
I
think
think
it would
Most
be
of
good
the
to hear
people
what
that
they
she
think.
talks to are the people that, that are in the community and represent the, let's say, human service community, which is very important to the, let's say,
Right.
to the support of the population that needs this type of housing.
And I'm not saying that that's not, so you guys wanted Beth to say, this is the commissioner's policy, we
Yeah.
really think this is important.
Yeah.
That's not such a bad thing.
I
but-
think before the advisory council could advise you, they would need to have a thorough presentation and bring everybody up to speed, which they have not done yet.
Right.
This is more of an I think what you have in mind, and correct me if I'm wrong, is simply to make the statement that the commissioners have taken a position on this ballot question, and this is what it is.
And indeed, I think.
And I think that's fine, but you answered my question.
Yeah.
And you'd have another meeting of this group before November 2nd, right?
No.
So I think it's, Bill, let me
Yes,
go
we
back
do.
to my,
Oh, that's right, October.
so it's really recognizing that the comprehensive permit process for low and moderate income housing has issues that need to be addressed through some reform mechanism at the legislature. The commissioners are urging their constituents and to vote no on question 2 because of the impacts, the potential impacts and the potential loss of 12,000 affordable housing projects, which may be impacted by a positive vote on question 2.
Remember, that's 10,000 projects across the state.
Across the state, yes, I recognize that. And the economic development impacts associated with those projects.
Okay, so could I propose that?
I'll craft a vote of similar spirit.
I need a second.
Yeah, I'll second it. I mean,
Discussion
That's
on the
fine.
motion. Any further discussion on the motion?
no, I mean, I just think that this is a program that has worked very well. I mean, I've had, my problems with 40B is that it's always been, the development has, the intent of 40B was to equalize the housing stock of affordable housing with non-affordable housing. And because of the skewed balance, like, a development doesn't necessarily have to go beyond 25%. You're never gonna get an even development if it's not like 50-50 all the way, or, and some of that discretion is up to the boards of selectmen and the planning boards of the area. It's not without some influence of the towns it's being built in. So, and I do think that obviously from the numbers you're stating, it has been a great benefit here, and people have been aware of those influences that they can exert. I just hope that that happens across the state, and I do think, on the whole, yes, I absolutely support it, but I also support looking at where people perceive weaknesses in their
Well,
legislation.
the
and ensure
monitoring,
that-
the financial monitoring, I think, which now more towns are providing that financial monitoring in projects, which
Right.
they didn't do before, because in the early years, some of the 40B developers
It was
came in
just a way to get through.
and obviously came out with more than what was
In past time,
originally
the,
intended.
Right, it was abused.
In
Yes.
past time, the county has put money into an observation or an accountability program. I think we gave a grant to HAP.
Probably the housing assistance,
Housing
right, for the
assistance
home
to-
ownership units.
The home ownership
Yeah.
units, to make sure that they stayed affordable over time, because prior to that, there was no monitoring of the maintenance in the affordable housing program.
Right.
So, we have some history of trying to, maintain the viability of the program. And so to me, this is
Right,
sort
in
of a
recognizing
continuation of
the
that.
shortcomings.
Yeah, and there has been, through state regulations, much more significant requirements with respect to the financial
Right.
overview of projects by for-profit entities than there was in the early part of the decade. So that has significantly tightened up as a result of just the gaps that people
It's
found.
like throwing the baby out with the bathwater.
Exactly, and that's-
Just throw it all out, and then we have nothing.
Right.
So we're better off if we can get the legislature to craft whatever changes are needed, positive changes, and not just throw the whole thing out.
Right,
In the
so
housing
in that-
consortium, I think that if you were to survey them, you'd find that some of the towns have taken different approaches with regard to the percentage of units within a project that
Right.
have to be affordable. I think at Harwich it's 25% now, to be considered to be eligible within the town. That's what they're looking for. And I think other towns have a different level of percentage.
But can I just ask you, Bill, the 12,000 refers to
Projects.
projects or units? Do we
Projects.
know? It's
Yeah.
project, that's
I
an
think
awful
it
lot.
says,
I can't, that's, I just thumbing through and couldn't.
You couldn't find- it was in the
I won't say anything
Globe
on there. This
article.
came out of the Advocate stuff, and I think that's in the, is that, you don't have the
Might
article
be.
here, but there's an
Do
article
you
in
know?
the Globe.
Do you know?
How many
I
units?
thought I
That's fine.
had it.
Okay.
I have it.
Yeah,
My guess, Mark,
it's
would be,
over my desk.
Oh, it's
What
over.
is Paul, I'm sorry.
I said my guess would be that would be units rather than
That's
projects.
my
I
guess
think
too,
it's
that's,
units too.
because that's
Those
an
are units.
awful lot.
Okay, what did it say in the Globe?
Well, I think it's units, but we can check it. It's
We'll
in
just
the
check that,
article.
but so recognizing that the comprehensive permit process governing low and moderate income housing has flaws that require reforms at the legislature, the commissioners are taking a position that they are against the ballot question due to their concerns over the impact on the production of affordable housing and the economic impacts of potentially losing 12,000 affordable housing units and the related construction jobs.
And they're urging people to vote no.
And are, okay. And
Well,
they're urging voters to vote no on this question.
Question two.
If you could add maybe badly needed affordable housing market. I mean, it is.
Wouldn't hurt.
It is, it's very badly needed,
It is.
and rental housing as well, so I was having.
If we're going to create jobs,
As
we
an
have to have, we
And we have to
have
have-
affordable housing, that's for
We have to
sure.
have rental
I mean,
and
look at
housing
the-
units people can afford.
I mean, there are a number of projects, as I say, there's 6 sitting here looking for, and if the funding were available, will A, the housing be created, and B, some people be put to work,
Right.
working right now.
Right,
So are we ready to vote?
yes.
Okay, all in favor, say aye.
I-
Opposed?
And the motion was made by you and seconded by
Seconded
you?
by Sheila.
Thank you very much.
Thank you.
Thank you.
Okay.
And
Thank
thank
you.
you for coming.
You're
both of
welcome.
you. Thank
Yeah.
you.
you're on your own.
I'm going to come to Beth for one quick second, because I know she has to run for
I'll just
something.
send you probably
Well, I
this
think,
cover sheet
I
tomorrow.
just, oh, do you have any?
I
gonna grab you
actually
a
don't have
sure.
anything else. I have my kids' open house at school, my daughters.
Oh,
That's what I was
This,
wondering.
this meeting with.
I looked up 6, that's a contract, I guess we asked the collaborative to proceed, but it doesn't mean
Oh, yes, okay, yeah, all
I'm
right.
good with that. Maybe I was asked it.
You did
yeah,
those?
we voted.
And who did the motion, do you remember?
Bill,
Bill?
and she'll second it.
Okay.
Move to adjourn?
Public comment?
Oh, public comment, yes.
I have a brief report on the status of the streaming video on the,
Oh,
of the
yes.
meeting.
Good, good.
The IT department and I have worked very hard over the last several months, particularly John Morse and Chris Burt of IT. And with the county's investment in some software and my investment in some hardware, we now have a solid, high-quality stream of your meetings. It's- so-
All we need is an audience.
So starting next week, when Kara sends out the agenda, I will send out a follow-up to all, inviting all who receive the agenda to view it at this particular website. Also, if you are traveling and can't be present at the meeting, it has a function where you could actually watch it in Tuscaloosa and be able to type in a question or a comment, and it would show up on my screen here. Oh, in fact, Barnstable County IT looks good. Audio's clear, but not as loud as perhaps it could be. You can, I feel the microphone on the table in front of them. So we've got some things that we're tweaking.
So
Okay.
we should, so does this mean,
Speak up.
Steve, that we should maybe during public comment say, are there any questions, that kind of thing?
Yes, and
if
invite
we-
people at home to
We could do
email
that.
Yeah,
questions.
that'd be great.
Yeah.
Yeah, we're supposedly doing this in order to get participation.
Be careful what you wish for.
Yeah, that, be careful what you wish for,
Yeah,
exactly.
but there is something important though, that although you can type in questions, you can't use this for the participation thing that they talked about in the remote.
Yeah, it wouldn't be that anyway,
It
because
would have to be
it's not
something-
one of you three.
No.
Right.
But in terms of remote participation, if we had a conference call, set up where we could all be talking at the same time, then that's considered to be
Yeah.
part of it. We're going to send that to Joe.
Yeah, before you adjourn though, I did have, because Sheila was talking about maybe getting together to discuss the kind of wastewater issue. Next week would be good. Upcoming meetings, on the first meeting in October is October 6th. Tentative start time at 1 o'clock. We're going to do the AmeriCorps pledge ceremony.
Oh, yeah.
So that's already here, so it's that time of year already.
Wow, that is
And-
amazing.
Tentatively on October 13th, the next week, I was hoping that I would be able to schedule our meeting in Bourne, somewhere over near the former county hospital facility, either in the assisted living facility or somewhere over there, or Gosnell, somewhere. And you would be able to do a tour of the thrift shop. The thrift shop people have wanted us to
Oh,
kind
yeah.
of come and visit them. Remember, they're in a former doctor's residence. They fixed it all up. It had been vacant for many, many years.
Yeah, a garden too this year.
And they're working on a garden over there that they'll be able to
And
show you.
what time is
so.
that to start? In the morning?
That, on the 13th, we could do it anytime.
Anytime.
There's no assembly, so it's entirely up to you
And what
guys.
time is the 6th?
The 6th is tentative 1 o'clock.
1 o'clock,
I just have to make sure with Darlene, but I think it'll be 1 o'clock.
okay.
There will be assembly meeting on the 6th, so then we'll have to kind of figure the rest of that out.
Okay,
Just to let you know.
and we'll be doing a wastewater discussion. And,
On October
Are
6th.
you gonna reach out to the selectmen?
Yes, I'm going to reach out to the
We could do it on
selectmen.
the
I will
6th.
give a report back to you of how this is going. I already asked
We could do it after the
Andy.
pledge
I talked
ceremony,
to
so the
him about it.
wastewater thing, say maybe, 2 or 2:30, gonna give people time, because remember, we had 26 AmeriCorps folks there in, and there's a bit of a,
26.
So what date are we
Socializing
talking
and-
about? I'm sorry, we're talking about the wastewater coming on the 13th?
on the 6th. The
On the
13th
6th.
wouldn't work, because we're gonna be off-site,
Yeah.
so I would suggest either the 29th, if you think you can
Okay.
pull it together, or the 6th, which is
Okay,
probably
I will
more
get back to you
doable.
on that and everybody will know what's going on there.
And don't forget to give Kara some dates for the famous vegetation management thing.
Oh, I thought you were just gonna throw out some dates.
No,
Should
I
we-
want, I
You
know it's
wanted
your
me to do it?
calendar that we were
Okay.
kind of waiting for. You're kind of the cornerstone of that.
All right, well,
so-
let me do that right now.
Yeah, well, you give them to Kara before you
Okay,
leave. So she'll have a couple, and then I'll pick one from the ones you give Kara, and then I'll just notify everybody, that's when it's gonna be, and I gotta get a place, and
okay.
blah, 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 all that stuff. We'll work on that. But everybody is sort of, everybody's on board, they've all gotten their letter.
Okay, so on the 13th, what time are we gonna do our meeting with the first?
We don't know yet.
We haven't picked yet, so if you have a
It would be like
preference,
10
throw it
o'clock,
out.
and then 8 o'clock since I'm coming from Wellfleet to Bourne, so. Give me a couple of hours to get
Well,
there.
we can do it anytime, because there's no assembly, so
Yeah.
it's purely at your
So we
guys'.
should
Well,
do
it's
it
up
in
to
the
you then,
morning.
Madam
And
Chair.
let's do it at 10.
Yeah,
Yeah,
that
fine.
sounds good.
That's all right with me.
That I can do.
All right,
Works for me.
okay.
Okay?
And I guess I should just mention that the CMed committee, hopefully tomorrow, the fire chiefs will nominate their member, and we'll pull that together. We're gonna do the next step on that,
Okay, do you attend the meeting on the 29th?
too. We haven't decided. I guess that's a good question. I don't have any agenda items on the 29th. So 9, 29,
Is it possible that we'd see the wastewater people on 29th? Is that what you're?
Instead of the
No,
second.
I would rather not, I mean, I'd rather not
that's
push
kind
it
of,
that
kind
quickly.
of tight.
Yeah, that is very
Especially if
tight.
you're inviting selectmen, that's very tight.
What's tight?
So on the 29th, whenever you guys want to meet, it'll be a very short meeting because we don't have any agenda. items.
Mhm.
Okay.
Thank you
So
for
anybody have a
accommodating this
preference?
late afternoon
Sure.
meeting today. so.
Anybody have a preference on the 29th?
Not yet.
10 o'clock, because there's no assembly.
Um,
Well, let's
9
just say
That's fine,
let's
10
say
o'clock is
10.
great.
10 o'clock, okay.
for now.
And it'll be just general business. Take questions from the audience.
So is Steve
Actually,
coming to the,
I probably won't have
thrift
any
shop?
Oh, absolutely.
Okay, just let me
What
know
thrift shop?
before Monday
Yeah,
at
to
10
come,
o'clock.
it's the thrift shop, we
Markmore's? Oh,
Yeah.
provide the building and
Good.
the lease.
Especially if there's a community
Yeah,
garden.
that'd be
Yeah.
to do
great.
the review?
Yeah.
Okay, excellent, yeah.
Excellent. Good stuff.
Yeah,
All right.
get going. All right,
Okay,
Yeah.
excellent.
hearing no other business, last for a motion to adjourn.
I will make that motion.
A second.
All in favor, say aye.
Aye.
I have to sign.
Terrific.
Well, I do too.
Thank you.
So I'll pass them on.
Thank you very
Here,
much.
okay, can I just have your ear for 1 second? Oh, wait.